73 out of the over 950 patients that were screened for tuberculosis from January to October this year at the Tamale Teaching Hospital tested positive for the disease. Of the 802 negative cases, chest X-rays suggest that 103 of those patients were extrapulmonary and required TB treatment. Statistics also reveal that quite a number of infant deaths were due to TB, as most of them were not immunized in the early stages of their birth. In the bid to increase the awareness about the TB as well as minimize stigmatization in the communities, the Tamale Teaching Hospital has organized a sensitization campaign in the metropolis targeted at lactating mothers, aged and young people in the community. The campaign is also supporting the immunization of infants during the first week of their birth, as they are prone to contracting the disease. The institutional TB coordinator at the Tamale Teaching Hospital, Amos Bugri, speaks on the exercise.
Of late, we realized that most of our cases were coming from this community, and looking at the environment, it's a crowded environment, and we realized that we needed to educate the community, the people, as to how to prevent TB, more especially the women and the children. Most of them, even though they are close to the hospital, they still give birth at home, and they don't come with the children into the hospital for us to vaccinate them against TB. We have a vaccination we call BCG, which we vaccinate the children. As soon as you are born, the first week of delivery, we vaccinate the children to protect them against this tuberculosis. So that is the message that we have brought into the community, to educate the women and the children especially, so that they will know that there's a vaccination called BCG, which they can be vaccinated against to prevent tuberculosis.
The head of the chest unit at the Tamale Teaching Hospital, Dr. Iddrisu Yahaya, noted that urbanization had led to the increase in air pollution, resulting in the increase in TB cases.
They are normally the first to come to the hospital, even though we are referral, because they are close, they come mostly, and then we know that there is a rise in TB here. That is it. Apart from that, generally in Tamale, there is a rise up to 83% of tuberculosis because of gross urbanization and pollution of the air.
Amos Bugri appealed to residents to support each other in the fight against TB by assisting individuals in such conditions to seek early treatment at any health facility in the metropolis. Noah Nash, for Versa One News.